Substance use disorders are patterns of symptoms resulting from the use of a substance that you continue to take despite experiencing problems as a result.
The term drug can refer to any chemical substance that alters your brain chemistry, affects your feelings or perceptions, or changes the way your body functions.
Substance use disorders span a wide variety of problems arising from substance use, such as
Taking the substance in larger amounts or for longer than you are meant to,
wanting to cut down or stop using the substance but not managing to,
cravings and urges to use the substance,
not managing to do what you should at work, home, or school because of substance abuse,
continue to use even when it causes problems in relationships,
giving up important social, occupational, or recreational activities because of substance abuse,
using substance again and again even when it puts you in danger,
continue to use even when you know you have a physical or psychological problem that could have been caused or made worse by the substance.
Overall stats on substance abuse have been decreasing in the past 10 years. The average age where people begin to abuse substances is 15 years old.
Youth aged 15 to 24 are using drugs at a much higher rate than their older counterparts. The 25.1% using cannabis may be a decrease from previous years, but that is still far above the rate of use by Canadians over 25, which is 7.9%.
Use of alcohol among adults has remained steady, with alcohol use patterns showing that 35.7% of Canadians considered themselves frequent drinkers.
In 2010, 14.6% of Canadians reported that they had experienced some form of harm due to alcohol use, while 2.1% reported some harm as a result of drug use.
Physical dangers to the user include
developing a tolerance to the drug, needing more to reach the desired effects of the drug. Developing psychological and physical dependence. You've gotten used to the sensation that a drug generates, and you feel disorientated, edgy, or unable to function when you can't take the drug.
Physical symptoms, withdrawal symptoms when you're trying to cut back or quit.
Other physical problems like irregular heart rate, high blood pressure, lung damage, and seizures.
If you think you might have a substance use disorder, see your doctor. They may need to refer you to a specialist or an addiction clinic to determine whether you have a pre-existing mental disorder and to ensure that you receive the correct course of treatment.
Untreated substance use disorders can be harmful to your health, your relationships, and your life as a whole. They can be fatal, so get help as early on in the process as possible.
Remember to check on your friends and be kind to one another.